Hello, and welcome back. We're still on this SARS CoV-2 virus and COVID-19 infection. We're going to kind of talk a little bit more how this virus, as it continues into its disease process and you come down with COVID-19, what other things go on. Now, just to keep it simple, as a person is infected by the virus, your symptoms can be either mild, can be moderate, or could be extremely severe and fatal. And if you see, a lot of our patients don't really suffer the more severe course, but it is those that are in a population that has a lack of a robust immunity. And so those are our populations that we really are looking out for, that may develop more into the critical symptoms and severity. Now, what happens when this virus enters the body, then it somehow starts sending signals. These signals usually are regulated by the body's immune system, but it causes it to go haywire. And so in some cases, it's causing blood clots. The body is not able to create an anti-blood clot to keep everything flowing, and it causes this shedding of these micro blood clots. And so that's that first diagram of the foot there. It's causing a vasculitis, and these blood clots are going down there and shedding there. It also affects different other mechanisms in relation to blood pressure. And it can cause issues in communicating to the heart and the blood vessels, and it may cause these blood vessels to become much more incapable of performing its job. We do know that severely, when it affects the lungs, it causes the lungs to sort of just become unable to exchange oxygen for the body's carbon dioxide. Ultimately, when it's in the severest of cases, it affects multiple organs, such as the heart, the brain, the lungs, blood vessels. And when you're trying to prevent somebody from getting worse, it's hard to chase all of these organ systems to make sure that the body functions.
So do you think this would, like, let's say the toes, they should also have the respiratory symptoms as well, most common? So not only if your foot starts getting swollen, but you should also have the other symptoms along with this.
Yes. So yes, you would probably have the original symptoms such as a fever, cough, difficulty breathing, or this type of silent hypoxia where you just feel fatigued, just feel difficult breathing. It may also have the loss of smell and taste, as well as maybe some other GI problems. But definitely, by the time you see that picture right there with the feet there, you would have other symptoms related to it. And when they're showing this other bottom picture of the lungs become so damaged that it's just difficult for air to be exchanged in and out through the body. And the person goes into what's called sepsis, or even worse, septic shock. And it's devastating. It then shuts down body systems, and when they shut down, it's hard to get them to start to work again and function properly. All right, so we're going to end here. Just want to make sure that we're not trying to teach you much. We're just trying to inform you, and there are many other wonderful sites out there for you to look up. All right? Stay safe out there.